So my name is Carrie Foote. I'm here in my capacity as chair of the HIV Modernization Movement Indiana. And I am also a woman living with HIV. I tested positive in 1988, so I've been living with HIV for 34 years, a very long time. It's really important to modernize these because the laws in Indiana were enacted in the early years of the HIV epidemic. So this was before effective treatment. This was in a time of fear, stigma was really rampant, and people just didn't know, how do we contain this epidemic? And so some legislators across the US enacted laws thinking that if we have a law that criminalizes certain behaviors, maybe that will help prevent HIV. But fast forward to today, we found they don't. They're actually very ineffective. Not one study has shown that these laws have any kind of public health benefit. In fact, they've shown quite the opposite, that they actually work against good public health interventions. They add to stigma, and stigma remains a huge barrier to people getting tested, knowing their status. We have a slogan in the community: take the test and risk arrest. You can only be arrested if you know your status. That's a disincentive to get tested. We want people to know their status. Arresting people under any of these laws that we have in our state, HIV criminal laws across the United States, has zero public health benefit. So a complete waste of our taxpayer dollars, where we could be using those dollars for effective HIV prevention. I remember talking to a doctor who provides pediatric care. Here she's telling these beautiful children living with HIV, you can be like any other kid. You can have families, you can get married, you can have children, you can be whatever you want. But when they're teenagers, Indiana law requires her to tell her patients about our HIV law. So at a time where she's telling them, trying to take away stigma, she directly stigmatizes them by telling them they're potential criminals if they don't do certain things. It totally goes against best medical practice. Do no harm. No one should be criminalized because of a disease status. And they really just need to modernize and catch up with the great science that has happened over the last 40 years. Well, now it's time to fix these laws that exist across the US, and in my state, Indiana, we've got several of them. We now know when we're treated with HIV, not only do we live long and well, but treatment actually, we can't pass it on sexually to others if we're successfully treated. And now we're in a time where we can actually end the HIV epidemic. HIV is 100% preventable. People who test positive can live long, healthy lives. Indiana has a beautiful Ending the Epidemic initiative called Zero is Possible. 0 new people testing positive for HIV. If they are living with HIV, they can do well, they can be healthy, and we can get there. But we can't get there if stigma remains around this disease. Stigma keeps people from getting tested, keeps people from getting into care. We can end the epidemic, but we need your help to eliminate stigma in our laws.